Hi everybody, I'm John Simoes and I am excited that we have been doing this podcast now for some months talking about healthcare and access here in New Hampshire on behalf of Our Care New Hampshire. And today we're doing it in person and we're doing it in a very special place, Franconia, New Hampshire. But we'll get to that in a moment. The North Country, New Hampshire is a place that really defines our state. And it's a place that people enjoy recreation and they enjoy living. But healthcare here and other rural parts of the state might be getting a lot more difficult in the coming months as cuts come from Washington, D.C. and from Concord, not simply to Medicaid, but to the Affordable Care Act in general. And requirements are being put in place in terms of work requirements around Medicaid. All these things mean fewer people in the system and more difficult access. So what we've done is we've brought together a group of folks from the North Country to talk about the potential impacts, but also talk about ways forward, because I think that's very important. So Ed Shanshala, who has been with us, 4 or 5 times, yes, from Ammonoosuc Community Health Services, yep. And I'm sorry, Daniel Sherman from Speare Memorial Hospital in Plymouth, and Angel Larcom, right, from the Littleton Area Chamber of Commerce. Whew, it's always the introductions that get me, and I apologize. Thank you all. So we're going to talk about it, the perspectives today from a hospital, from a federally qualified community health services group, and also from an economic point of view and the businesses here in and around the Littleton area. Now we're here in Franconia, Ed, and this is your clinic, and this clinic's already been impacted. Do you mind if we start off talking a little bit about what's going on here and what that means?
Yes, that's perfectly fine. When we look at the bill that was passed in July, the economic impact on Ammonoosuc Community Health Services is a disinvestment of $500,000 that we're anticipating due to the changes to Medicaid expansion and Medicaid in general. We could not wait to take action, so we have announced the closure of the ACHS Franconia site, of which we are sitting in one of the exam rooms. And no later than the end of the year, we will redirect patients to our Littleton site and to our Whitefield site. We're sorry to have to do that, yet that's the economics, and it's a decision that we had no other choice to make.
And we've seen these decisions happen to other communities in New Hampshire, in Claremont, on the seacoast in Rochester. What's the impact of the community going to be, and how are you working in the community to increase access based on this decision?
So there were no layoffs, and patients still have access to care at Littleton or at Whitefield. Realizing there are transportation challenges, we have staff and patient navigators, we have funds to help people find the transportation they need to get there. The other facet of our loss of $500,000 investment is for every dollar we invest into primary care, we get a return on $13. And for every dollar of Medicaid that comes in the local community, it's a 3-to-1 economic multiplier in paying a mortgage, buying a car, childcare, or a cup of coffee. And I think Angel will be able to talk a little bit about the economic impact. Since I've lived here for 20 years, I've seen the economy grow. Mm-hmm. So it gives me concern about the impact on the broader economy beyond healthcare.
Well, let me put that to you. Now, Angel, you run a business in the Littleton area. You're the president of the chamber?
I'm the executive
director of the chamber.
chamber.
Littleton, I mean, there's a statue of Pollyanna in Littleton,
Mm-hmm.
but it's a city that seems to be doing well for itself. You know, the
It
downtown seems thriving. It's a great place to live, not far from the Vermont border, not far from the border with Canada. Obviously, healthcare, there's a hospital there. This is an important part of what leads families, what leads companies to locate there. What do you see coming on the horizon? I know you said earlier you haven't heard a lot from folks yet, but this news is new. What's your perspective?
Well, I think it'll have a negative economic impact simply because if people are losing access to Medicaid or affordable care, then their discretionary income diminishes. And so then they won't be able to shop and support local businesses. And our North Country isn't an urban center, right? So there isn't a lot of large-scale manufacturers or employee that have hundreds and hundreds of employees, right? So they can't even offer health insurance because they can't be competitive in the market. And so everything up here is small business. It's mom and pop shops, it's those little brick and mortars. And they do depend on the tourism, but they really do depend on the local people shopping in their businesses as well, because we all have to keep each other afloat during the off seasons, right? Which we have 2 shoulder seasons. So yeah, and I think also it will affect employees, right? So if somebody loses access to this coverage, their ability to work consistently or work full time may be impacted by disability or, you know, the illness of a loved one. And so then that sustainable workforce thing becomes an issue as well.
A lot of people up here have seasonal jobs, right? They might work in the Speare in the winter, they might work in hospitality in the summer. That leads some of them to Medicaid, it leads others to the Affordable Care Act where they can buy their own coverage on the exchange. We know that there's some advanced tax credits that probably are going to expire at the end of the year. How does that put the economic picture into moving into 2026 when so many folks have jobs that require medical plans through the Affordable Care Act?
I think if they have to jump through more hoops more frequently to justify coverage that they're getting, that becomes unstable. It destabilizes, you know, everything at the economic level. I think a really good solution might be an insurance cooperative where small business owners are coming together in mass up here and building this cooperative, kind of like a food cooperative or whatever, where they can be more competitive, right? So if you have 10 employees or you have 40 employees, but you all come together in a cooperative, then there's bigger buying power in the marketplace.
And I worry about it with the loss of insurance. They may come to us, and we do have a sliding fee scale. And the sliding fee scale comes out of a base grant of our tax dollars of $2.2 million that we generate a $12 million budget, has not seen any economic increase in a decade. So that's an erosion of $750,000 plus the $500,000 of negative impact on Medicaid. Or they don't come to us and they end up in Dan's emergency department without insurance. You know, so I worry about the businesses, I worry about the patients we see, I also worry about the patients we don't see that may present at the hospital and may not have a way to pay for it.
Right. I was going to ask you that question exactly. I mean, you're in Plymouth, in a major hospital. Plymouth is, I always like to say, like a Mount Pilot to many Mayberries, right? Surrounded by very many small towns in the Lakes region and the White Mountains. You've got a university, you've got a major ski area, so there are people who have seasonal jobs. But I would imagine that a percentage of the patients you see every day are either covered under the Affordable Care Act or under Medicaid expansion. How do the economics look going forward? Because obviously you provide a very important service to many people from miles away.
Right, exactly. As Ed said, you know, everyone is a consumer of healthcare services. Everyone's going to eventually need to utilize healthcare, whether they have insurance or not. And as we see, our predictive models are currently showing that given our population, we're looking at a loss of roughly $700,000 to $800,000 in the coming year due to uncompensated care. That's folks who are going to seek emergency care that don't have any way to pay for it. And so that's driven, a lot of that is going to be people coming off the Medicaid rules because of these onerous requirements to maintain Medicaid coverage or coverage through the exchange.
So how are you preparing for that? What changes do you see? I mean, here we're talking about this clinic closing in December. What's Speare thinking of in terms of changes that need to be made to continue to be viable in 2026, 27, and 28?
Well, we're going to have to take a real close look at our operations and the services that we're providing. You know, obviously those lower revenue generating services are at the highest risk. We were talking about obstetrics earlier and how New Hampshire is becoming close to becoming a obstetric desert where there's just nowhere that, you know, expecting mothers can have prenatal care or have their babies in a hospital environment. And those are one of those services where we really have to take a very close look at that because it's OB is a very high Medicaid population. Right? A lot of expectant mothers are on Medicaid, and if they lose those Medicaid because of the work requirements, because of the additional co-insurance that's being put in place, that service may be in jeopardy. Right? But we're also looking at bolstering our other services and growing our others as well. We have 2 urgent care, walk-in care sites, our primary care services, and strengthening our partnerships with other area organizations as well, like Ammonoosuc and other community health centers.
So we say it's fair to say that there's some dialogue going around the North Country from Plymouth North about how current providers can work together or work with local chambers to come up with viable solutions in the face of significant changes?
I think so, and I think Angel points to one. When we think about that group purchasing and insurance, often they're called captives, that allows a better pricing. I think what my concern is that people may say, I don't have Medicaid, and I understand that, and as Dan and Angel point to, the ripple effect of if the lack of Medicaid dollars results in the loss of a service like obstetrics, that it doesn't matter what your insurance carrier is, there's still no obstetrics. On the bright side, we've started at Ammonoosuc moving upstream by putting behavioral health into K-12 schools to get the kids the care they need before they get to a point where they may self-harm or self-medicate. And then more recently, we had our food as medicine program at Speare Memorial. They have programs that line up well with ours, that the more that people can engage in health and wellness beyond coming to see us, that they can find ways to 30 minutes prep to plate, learn how to prepare meals that aren't that hard and hopefully affordable. So there are some areas that we're trying to get people engaged in healthy behaviors before they see us, before they end up in an emergency room. So those are good investments, I think, moving upstream where people live their lives.
Well, 2 things I'm hearing from outside of this conversation that concern me. One, some are predicting that folks who get their health care through the exchange could see their premiums jump by 70% because of all the uncertainty going forward in New Hampshire around not the healthcare system as much as how we're going to pay for it. Secondly, the work requirement hasn't really been implemented successfully anywhere, and there's been a lot of challenges. How's that going to happen, especially with a Department of Health and Human Services with diminished staff and diminished funding? So as we're looking forward, from an economic perspective, from a hospital's perspective, from a community health service system perspective, what can we do now as individuals, as communities and groups, to maybe try and put some circuit breakers in along the way that could help those who make these decisions understand that I know that money's been set aside in a very large pool to help transition rural areas across the country, and it sounds like a big money number to start with, but when you put it across all the U.S. and you realize it's a one-time thing, it seems like more of a Band-Aid than it does like a real medical intervention. So my question is, what folks listening to this, what can we do? Who can we talk to? What should we say in a positive way to try and safeguard the medical system and access and affordability for ourselves and for our community and for our neighbors? I put that to anybody who has an answer because I don't know if I have one.
I mean, advocacy is always really important. And I don't think people necessarily appreciate how strong their voice really is and can be, especially now with social media. I was mentioning earlier, our senior leadership team released a letter to the public about the potential impact of the big beautiful bill in New Hampshire, House Bill 1 and 2, and it had the most circulation of anything that the hospital has ever put out in their history. It had over 100 shares. We had over 6,000 views, and some people commented underneath it, which patients who had good experiences said, you should really use the services of your local hospital. Mm-hmm. You should use rural services when you can. You should donate to your rural hospitals, to your healthcare facilities when you can. Sure. Think about them in your will, in your trust. Those kind of things are ways that people, on a day-to-day basis, just engaging through social media, I think really is the way that people can have their voices be heard.
I always tell people to be polite, professional, and persistent. And it's 900 pages of the bill. Mm-hmm. And helping people understand that even though you don't have Medicaid, here's how the healthcare system connects. When you take this piece out, here's other pieces that start to fall away. And when we look at the marketplace and commercial insurance premiums going up, that'll adversely affect our ability to provide competitive health insurance to my 100 staff. And when I look at the small businesses, And I talked to some who will tell me what their insurance is. They'll be adversely affected because maybe they qualified for Medicaid and that won't happen anymore. That they got tax credits through the ACA and that won't happen anymore. So they're small, they can't afford to have a staff or two staff out sick. They don't have the bench depth. They make significant contributions to our community in many ways. And it seems like we as society should make sure that our friends, family, and neighbors have access to health care. And so the people who do make policy, federal and state, and budgets, need to hear that we want the money put into our friends, family, neighbor health care, and we're maybe less interested in that top 1% getting tax breaks.
Yes.
Because overall, global economics, it's not even economically sound. Hayek and Friedman, the Chicago School, would probably respectfully disagree with the bill.
Any thoughts, Angel?
I know that we have been communicating with an area insurance agency and small business owners that are highly interested in doing the cooperative. So we have a forum scheduled, I think, for October, the second Tuesday in October,
Oh, great.
to introduce the concept of, a health insurance cooperative for small business owners and their employees up here. And I think that we're going to get a really strong response to that. I think the whole project started as a result of small business owners initiating those conversations, so it's really local led, which usually builds success, right, when we're all working together. So I'm excited about that, to see how competitive it can be and what it can offer to our small business owners up here and their employees.
And I'd love to hear the BIA, the Business Industry Association, weigh in, because it does have an impact on the health and wellness of their membership and their members, employees, but also has a significant economic impact. The number one revenue stream into New Hampshire, regardless of what we think about it, is Medicaid.
Yes.
And so if you're at the state level and you're sitting in the governor's office, I don't know what you would do to address that economic impact.
Or loss.
Yeah.
Of that economic impact. And one of the things I was thinking of, as we're talking, is we are having a staffing crisis in New Hampshire right now, and it's acute in hospitals and clinics, and it's acute in many manufacturing businesses as well. It's hard to attract people, and then the cascading issue is that it takes longer to get your blood drawn, it takes longer to get an appointment with a specialist, it's more expensive to hire a physician or a nurse, and those costs then escalate already other costs going up within the system, which impacts everything, and obviously it impacts access. So we're in a difficult place here, that we already have a shortage of people, and now we may have a shortage of coverage. I guess the question I have to ask is, how in the North Country are medical professionals or managers going to overcome that, to attract people to locate here, where the salaries might be lower, but the quality of living is obviously higher. But now we're going into this position where the revenue for clinics and hospitals may be impacted. So that would have an impact on a town like Littleton that needs workers, right? And a hospital like the one in Plymouth that needs workers, and yet it seems like one of those hard to understand paradigms, like where does it start, where does it end, and how do we put the two things together? Given these cuts, how are we going to be able to attract the staff we need and also give them the compensation that they need? Not an easy question.
I'm old
It's the
enough
$1 million question.
I was going to say, I'm old enough to remember the $64,000 question. Inflation will do that. I think part of it is, there is an economic reality to putting food on your table, a roof over your head, that we can't ignore. And that's going to take state and federal effort to figure out path forward, given the clear economic adverse impact on healthcare specifically, but on that broader economy. When we're competitive, then we have the chance that we're the fourth best public education in the country. We bounce back and forth with Vermont for who's fourth or fifth. Seventh lowest total tax state. It's not that I mind paying my taxes. I like to have my taxes invested in bridges that stay up, geriatrics who are well cared for, and children who are well educated. So I think I'm looking for a return on my tax dollar invested. And then you look at working in any of our shops or working in local businesses, people thrive and have a fulfilling work experience in the North Country. And that's harder to find in some other places. So that's that value add, but it doesn't replace, you can't buy groceries on a great work environment. You actually have to see it in your paycheck so you can buy groceries, pay your mortgage, get a new car, childcare, things like that.
I would definitely encourage people to start conversations with our elected officials.
Yeah.
We have one senator that represents the North Country. He lives and works right in
Yes.
Littleton. And then many state representatives, both Democrat and Republican, and they're both very accessible and approachable. And I think very often people don't realize that you can get that direct line of communication because these people are living right in the community alongside us. You know, it's easy to look it up online and find out who they are if you don't know. But hearing from their constituents, I think.
That's really good advice, thank you.
Mhm.
So as we wrap up, I'll see if we have final thoughts, but first a quick question, which is, you know, again, you've got a very useful and beloved hospital, but we've seen with these pressures in terms of cutbacks on the state and federal level, a greater wave of consolidation in hospitals. Obviously, you know, I'm not saying are the negotiations underway, but you know, how can a hospital work with all this going on to stay independent, to stay locally owned when so many bigger and smaller hospitals have been recently consolidated in ways that often doesn't benefit the community or costs? Like, what's your perspective at Speare?
Well, you know, we would be remiss if we didn't have that conversation annually. You know, do we affiliate? You know, are we at the point where consolidation is what's best for our community, what's best for our organization? And we still believe that freestanding critical access hospital better serves the needs of the community, more than a consolidated Dartmouth or Concord Hospital lookalike. I think we're able to meet the needs of our community a little more specifically. We respond to the community needs. You know, obviously financially things have been challenging, but we're looking ahead. We have a lot of innovative ways that we are looking to turn things around for the organization. But I think it really starts with rebuilding your image and the confidence of your community, and that's what our focus is really, you know, being that the hospital of choice, the provider of choice for our community, and making sure that we're who they look to.
I think that's a good answer,
Yeah.
and it shows that you're investing in your community. And when something's locally run, the folks who are making decisions are right there on Main Street, and so those decisions will probably be much more in line with what the community needs. So I mean, just going forward, and I end our conversation on this, and feel free to add into it. You know, this seems to me to be a major concern for 2026 and 27 going forward in the North Country. We hear a lot about childcare, we hear a lot about housing, we hear a lot about the market for staff and employees. How can we elevate this discussion to make more folks aware of the challenges around healthcare before it taps them on the shoulder? And I think that's one of the things we're trying to do with this series of podcasts. How can we not worry folks, but get them at least engaged? And I put out, any of you wants to try and answer that one too?
Well, I think educating the public is important, and I've worked in healthcare most of my career. It's a very complex system, and helping people understand how certain laws or budgets personally affect them, I think provides them with the information for the advocacy, because it's all of our health system. No one's outside of it. At some point in time, we're all going to touch pieces of it. So there should be a sense of ownership. There is no the other's going to take care of it. We're each other's other. And so we kind of have to stand up and go, what's this impact on myself, and what can I say that has different policies that support health and wellness, that have budgets that invest in the health and wellness from prenatal through nursing homes.
Any thoughts on that? How we can get folks more engaged at this point in New Hampshire, short of ringing alarm bells?
Continuing conversations at a one-on-one level with people as you bump into them in your daily life. You know, I have all kinds of conversations with people that lead to some really cool things and lead to some awareness. And a lot of people, unfortunately, you know, the cost of housing has increased, the inventory is low. That's a challenge, especially for our seasonal workers. You know, that workforce housing just isn't in place. We need to solve that yesterday. And so people, I think a lot of people are so busy trying to make ends meet, so busy trying to put food on the table and make sure that their housing is paid for, that they don't even have the time or the energy or bandwidth, especially if they're young parents or parents of teenagers. They're just surviving, right? And so if you run into people, have those conversations with them, because they don't have the bandwidth to even begin to think about it until, as you said, it taps them on the shoulder.
I'd encourage people to really feel a sense of pride. You feel a sense of pride in your community, in your family, and the groups you belong to. Feel a sense of pride in your health center, in your local hospital, you know, in your care provider. You're part of that close-knit community with your provider. You build that relationship. I can say personally, I've been a patient of ACHS for 22 years. I've used this facility many times because it's very convenient to me working in Plymouth. And it breaks my heart to know that it's closing and that the patients in this community won't have access to care here. And there are some folks that are going to have to travel quite a ways. And so I think people really need to vote with their feet. You know, really, like, if you really approve of something, go there. You know, support it, be a part of that community, and embrace it in every way possible. And then continue to advocate. Use social media, use your voice, reach out to your elected officials, let them know, hey, this is my health center, and I don't want to see the doors closed.
That's a great point. Thank you, Dan. Thank you, Angel. Thank you, Ed. Thank you for having us here today.
Yeah.
This is a very nice facility, and it's nice to share some moments here with you. I'm hopeful that folks are going to hear what we're saying and share these ideas. I think this is a positive discussion, but there are some challenges ahead. So I want to say, on behalf of Protect Our Care New Hampshire, I'm John Simoes,